Thank you, Mr President. Mr President, on 12 April this year, I was excited to attend an Australian College of Midwives half-day workshop to hear presentations from some of the amazing midwives in Tasmania and hear about some of the amazing work they're doing. A southern chapter of the Tasmanian branch of the Australian College of Midwives was also relaunched after a number of years in recess. Our amazing midwives are initiating some excellent programs that will have lasting beneficial impacts. A team of midwives at the Royal Hobart Hospital initiated a carbon monoxide monitoring program that has resulted in a far higher percentage of women who are smokers registering in smoking cessation programs, and that will reduce the risk of preterm birth. This program is being showcased around the country. Another important project has been the implementation of the Western Australian Preterm Birth Prevention Initiative across Tasmania within public and private systems. I commend the Government and the Minister for Health for supporting and financially backing this great initiative. Mr President, I'm sure members are aware of the risks associated with preterm birth. Effective measures to reduce the occurrence of preterm birth will have lifelong benefits for the child and ultimately reduce the demand and thus the cost of services required to care for and support preterm babies. Preventing one preterm birth earlier than 31 weeks will save the health system $600,000 in acute care costs and potentially hundreds of thousands of dollars in ongoing health care. Worldwide, an estimated 15 million babies are born preterm before 37 weeks gestation each year. Preterm birth is associated with significant morbidity and mortality and is a leading cause of death in children up to 5 years of age. The facts about preterm birth in Australia are sobering. A staggering 1 in 10 babies in Australia are born premature, approximately 27,000. Of these births, up to 1,000 lose their fight for life. Beyond the numbers lies the untold heartache for these families. In 2005, Tasmania had the lowest preterm birth rate in the country, 6.9%. However, over the past 10 years, the preterm birth rate in Tasmania has continued to rise and has consistently been above that of the national average. In 2015 and again in 2016, Tasmania had the highest preterm birth rate in the country, 11.3%, surpassing even the Northern Territory. The whole 9 months, the Western Australian Preterm Birth Prevention Initiative was launched in November 2014 with the goal of safely and effectively lowering the rate of preterm birth, saving lives and preventing lifelong disability. It was the world's first such program to be applied across an entire population. Following the implementation of the program during 2015, the rate of preterm birth in single pregnancies in Western Australia fell from 7.6%, fell by 7.6%, which is 196 fewer preterm births as compared with the year before, 2014. Very significant. Preterm births rose in every other Australian state and territory in that same year. So clearly it had an impact, Mr President. If we were to achieve a similar outcome in Tasmania, based on the Western Australian Initiative reducing the preterm birth rate for up to 31 weeks from 61 by 2%, this would equate to a saving of $854,000 for this cohort alone. $189,000 for the cohort of babies between 32 to 36 weeks based on the average length of stay of 16 days. So total expected reduction in costs at the Royal Hobart Hospital would be $1,043,000. Further savings at the Launceston General Hospital and North West Regional Hospital would also be anticipated as babies remain at the LGH for 32 weeks and uncomplicated prematurity at 34 weeks at the North West Regional Hospital and private hospital where they birth. In June 2018, the National Preterm Birth Alliance, a subcommittee of the Perinatal Society of Australia and New Zealand, was established in an effort to take the program to all states and territories with a singular aim of lowering the rate of preterm birth on a national level. Recognising the significant morbidity and mortality associated with preterm birth and the current situation in the state, it was imperative that all steps were taken to safely lower the preterm birth rate in Tasmania. Mr President, I won't go into details of all aspects of the program as time prevents this, but in broad terms, the initiative encompasses new clinical guidelines on outreach programs for healthcare practitioners, a public health program for women and their families, and new preterm birth prevention clinics. This includes the provision of appropriate ultrasound services for the accurate measurement and reporting of cervical length at mid-trimester anatomy scan, thus enabling appropriate treatment and management to assist in preterm birth prevention. The encouragement of smoking cessation, especially in women under the age of 20 who have the highest smoking rates of 1.3, and the provision of a dedicated antenatal clinic in each region to provide surveillance and management for women at risk. As well as the positive impact on future Tasmanians, we would be saving the health system hundreds of thousands of dollars. So, Mr President, at a time we are hearing so much about the challenges associated with our health services, it is great to see the government responding positively to a program that will create real benefit to mothers, babies and their families in Tasmania, and have a positive impact on the health and wellbeing of our babies and give them a much better start in life.